So today's lecture is on Chapter 4, and we are to be discussing safety and infection control. So we've spent the first couple of chapters talking about healthcare in general, healthcare careers, healthcare ethics and laws, and now we're moving into safety and infection control. Once we get through this chapter, then we can start specializing in different areas, and we'll be able to do some more cool projects and activities. But like anything else, you have to get down the basics before you can get into the intricacies. So most of you, I'm sure, have had an infection at one point or time in your body somewhere. And what happens is your body gets invaded by microorganisms. These microorganisms can be bacteria, viruses, or parasites. So bacteria is if you have like an infected cut and you get like that pussy stuff. We've all had that 24-hour stomach virus at some point or time in our lives. And parasites such as ticks or mosquitoes. Some people have gotten Lyme disease from infected mosquitoes. They're all different types of parasites. Ringworm. We could sit here and go on for days. What is involved in maintaining safe conditions in a healthcare facility? Well, we need to avoid danger, right? So we put up signs when the floors are wet. Any type of risks or injuries. So if somebody's not stable enough to walk, they need a walker. Infection control for patients, so learning aseptic techniques, and also those that involve healthcare workers and or visitors by wearing masks if either you or the patient is sick. Sometimes you're asked to wear gloves, booties, depending on the nature of the illness that the person has. Safety is of the utmost concern, being protected from danger and injury. And depending on where you work, each organization has its own specific safety regulations that you will need to learn and in some cases be able to demonstrate. Regulations are usually spelled out in the facility's safety manual, which you are responsible for reading and signing. These are some general safety rules that are included in all safety manuals, and I'm sure that these will make sense to you. You're supposed to always use handrails when using the stairs. You're not just supposed to just go up the stairs or come down the stairs without holding on to something. Never run in a hallway. That's one of our rules right here in the school, but unfortunately people don't follow it. Do not prop open fire safety doors. They're for a reason. Like when we have a fire drill here in the building, there are doors at the end of each hallway that close automatically. Store items in a safe manner. So, for example, here, chemicals have to be stored a certain way. Acids have to go in an acid cabinet, bases in a base cabinet, and flammables in a flammable cabinet. Even dry chemicals have to be stored on specific shelves so that there are no interactions. It's the same thing in any type of healthcare facility. Obey evacuation routes posted in the facility. Not only do we obey them here, but we practice them. And we practice different types of evacuation or hold in place or lockdown, depending on the nature of the emergency. In a hospital, there are specific emergency codes that alert healthcare workers to what is happening. These codes convey information without causing panic throughout non-healthcare related personnel, meaning patients and or visitors. Examples of codes: code red means there's a fire, code blue is a cardiac arrest, code pink is a child abduction, and code black is a bomb threat. These are standardized throughout all hospitals. A disaster is any sudden event that brings great damage, loss, or destruction. What are some types of disasters that individuals in the healthcare profession must be prepared for? So at this point in time, just shout a couple out. What are some disasters that you can think of? They happen all the time. I'm hoping that you have said a few of them. Hopefully, you came up with fires, tornadoes, hurricanes, earthquakes, maybe the other ones, the terrorism, explosions, gun violence, and catastrophic accidents you didn't think of. But certainly earthquakes, tornadoes, hurricanes, and fires you should have mentioned. Safety in the science lab. Most of you have taken a science lab prior to this class. Some examples of safety guidelines. Obey all rules posted in the lab. Beware of all safety symbols in the lab. You need to wear protective safety equipment, goggles and aprons, and familiarize yourself with the location and operation of safety equipment, such as the fire extinguisher, the fire blanket, where the goggles cabinet is, where the eye wash is, where materials get put if they can't go in the garbage can, where broken glass goes. Some universal patient safety guidelines include always identify the patient first. You notice that whenever you go for any kind of test or blood work is drawn on you, they ask you your first name, your last name, possibly your date of birth. You need to explain the procedure and make sure you have the patient's consent. Never perform a procedure which you are not trained to do. That opens you up for libel. Observe the patient carefully for any changes in condition or status. If you are performing something or giving, like say you're drawing blood or giving medication, those things are noticed right away if there's going to be a reaction. Normally, you won't see any changes in condition if you're just doing an x-ray or a sonogram. An incident report needs to be filled out immediately if something happens that's not part of a routine operation. These incident reports are used to document both safety and non-safety related occurrences. Like if you fall down the stairs, okay? You don't think you're hurt, but maybe as the day goes on, it gets worse. So that should always be reported to a staff member or directly to the nurse. An incident report has to be filled out accurately, completely, and immediately after the incident. You can't fall down the stairs and then a week later your pain is getting worse and you find out you have a fracture, because then you won't be covered. It's better to be safe than sorry. Fill it out right away. If nothing becomes of it, then it's fine. You just had to spend the time filling out a little bit of paperwork. But if something does become of it, then you're covered through the facility that has insurance. Employee safety. It's important to maintain employee safety as well as patient safety. Employee safety is governed by OSHA, Hazard Communication Standard Association, requires employers to educate employees about chemical hazards in the workplace. So every year we have to go through an OSHA training that tells us all about the safe handling of bodily fluids and chemicals, so on and so forth. And then we have to take a quiz on it. Every chemical that you use, whether it to be for buildings and grounds for cleaning or in the chemical laboratory, has a material safety data sheet. And we have them on a disk. So if someone were to get hurt, we would be able to refer to the material safety data sheet to know what to do for that specific chemical, how to either clean it up if it was a spill, or how to wash somebody down if it got on them. Some chemicals you just use water, some you have to use soap. So every organization that has any type of chemicals, or cleaning products has to have these MSDS sheets on hand. So there's lots of information on this MSDS sheet. It gives you the chemicals makeup, the chemicals dilution, a chemicals mixture concentration, and instructions for use, as well as what to do if somebody were to ingest it or get it on their skin. It tells you all different types of side effects that could happen. Electrical safety is also important. Failure to observe electrical safety can result in burns, severe skin damage, unconsciousness, or even death. You should never overload any electrical plugs or outlets and follow all electrical safety regulations in a facility's manual. Radiation safety is extremely important in hospitals or emergency care facilities that have any types of X-ray machines or radiation therapy. Factors involved in the degree of exposure have to be noted. The amount of radiation that is discharged from the device, the duration of the exposure, the distance from the source, and the type of shielding used. A principle to help remember this is called ALARA, as low as reasonably achievable. So you can get radiation exposure not just from treatment, but from being near any machine that uses radiation. That's why X-ray technicians go behind a wall, or when you go to the dentist, they go outside the room when they're pushing the button. And then your body is protected by a lead shield, which is usually in the shape of some type of apron. Also, for radiation treatment, adults are told that they cannot go near young children for a certain amount of time because their body could be emanating radiation through the treatment that they received. Granted, it's in small doses, so other adults aren't usually affected, but small toddlers or infants could be. Fire safety is really important in any type of business. In order for a fire to occur, you need fuel, you need heat, and you need oxygen. The fuel and the oxygen is what starts the fire. You need oxygen in order for something to burn, and the heat is a byproduct of the fire. You need to follow the facility's evacuation routes and emergencies plans. RACE, rescue, alarm, contain, extinguish. Just as we practice fire safety here, whenever there's a fire drill, we have to make sure all electronic objects are unplugged in the back of the lab. We have to make sure that the Bunsen burners are turned off before we leave. We all have an evacuation route. We know where we go when we stand outside. We have to take attendance because every person needs to be accounted for. It's the same thing in various organizations. So I bet you didn't know that there are 5 different types of fire extinguishers. I'm going to start with what we have here. We have a type E fire extinguisher. These are the most common types of fire extinguisher because they are for multi-purpose dry chemicals. We can use them on combustibles, flammable liquids, and electrical and equipment fires. Now, the other 4 are specific. Type A is a pressurized water, and that's just for ordinary combustibles. Type B is a carbon dioxide extinguisher for flammable liquids. Type C is a dry chemical for specific electrical equipment, and Type D is a Class D dry chemical for combustible metals. So depending on what type of art organization you are, or factory, or what you're dealing with, you may have specific types of fire extinguishers. You may even have more than one type of fire extinguisher located in various parts of the building. Body mechanics. This refers to the proper use of body movements to prevent injury, whether it be picking up heavy objects, bending down, even sitting for long periods of times at a computer station. We always want to use ergonomic practices to maximize our efficiency with our own body and to prevent any type of injury or long-term discomfort. Every type of organization utilizes some type of QI, quality improvement, and that's basically monitoring and evaluating services that make your institution safe and ways to make them better. Safety criteria are a major part of quality improvement, and several government agencies are involved in protecting health and safety. A part of that is infection control. Specifically, healthcare facilities strive to prevent the spread of microorganisms that can cause infectious disease. Microorganisms include bacteria, viruses, fungi, and parasites. People who have compromised immune systems are more susceptible to infections, and proper precautions should be taken if there is some type of infectious disease that is in that on that floor or in that room. I try to do some type of infection control here, especially in the September, October, November. Everybody's coming back to school. They're bringing all types of microorganisms with them, and students are getting sick. So I make it a point to wipe down the desk with Clorox wipes every other day, because you're touching your desk, you're putting your stuff down, other people are sitting there, and hopefully it minimizes that. So far this year, it seems to be a lot less than last year. So let's take a closer look at the types of microorganisms that we're talking about. First, we have bacteria. These are small, one-celled microorganisms. Cannot see them by the naked eye, and they can be pathogenic, meaning very harmful to our bodies. Usually bacterial infections are treated with antibiotics. So what should you know? Small, one-celled, can't see them, can cause damage, treated with antibiotics. So, myth or fact, some bacteria are resistant to most antibiotics. Is that a myth or is that a fact? Well, hopefully you are saying fact, because it is indeed a fact. When we treat certain bacteria with antibiotics, there are always those bacteria that are like the survivors, okay? Survival of the fittest. And they find a way to not be killed. And then they pass that information on when they reproduce. So resistance can develop if patients, A, do not take all of their prescribed antibiotics. So you take it for 5 days and you're supposed to take it for 10 or 7. And you're like, oh, I feel better. Antibiotics are prescribed when not needed. So that's also bad. If you just have a little bit of a cold or something's going on, try to let your body fight it off. Get good sleep, eat well-balanced meals, because if you take antibiotics at the first sign of being sick, you don't give your body enough time to strengthen its own immune system. Resistance also develops if a genetic mutation of bacteria has occurred. This can happen accidentally, or it can be happened by antibiotic resistant bacteria passing on that genetic information when it reproduces. Viruses. We've all had a virus. Viruses need a host. Your body is the host. Your body feeds that virus. They cannot produce on their own. And antibiotics do not kill viruses. So if you have a stomach flu or a stomach virus, there's no sense going to the doctor because they can't give you anything. Yes, they can give you something to help you with diarrhea if you have it, but you can buy that over the counter. If you've got profuse vomiting, they could prescribe an anti-nausea drug, but I think that there's a couple of those that are over the counter as well now. And if you wait long enough, the only thing the hospital could probably do for you is if you're dehydrated, they can give you IV fluids. Vaccines have been developed against many viral diseases: chickenpox, measles, meningitis, TB. There's a myriad of different vaccines for various viruses. Some of them are mandatory in order for you to attend school, and some of them are mandatory if you work in specifically a healthcare related field. It's also suggested that you just don't get a vaccine. The proper way to do it is to have the doctor draw your blood and see what the levels are in your bloodstream. You may only need a titer. You may not need one at all. You don't want to get a vaccine if your body doesn't need it. Other pathogens. Some fungi can cause disease: athlete's foot, ringworm, certain lung diseases. Protozoa, which are single-celled eukaryotes, which, if you recall from biology, means that even though they're single-celled, they have a nucleus. And they can either be free-living, out in nature, or they can be parasitic, meaning feeding on us, can cause amoebic dysentery. Amoebic dysentery is an infection of your intestines. And this is usually caused by contamination of food and water. Another disease caused by protozoa is trichomoniasis. And this is a sexually transmitted disease, usually caused by multiple sex partners and or not using a condom. And then we have malaria. And this is usually marked by a fever that fluctuates from high to normal, because of a specific parasite that invades the red blood cells. And it's usually transmitted by mosquitoes, and not something we have to really worry about here. It happens in tropical or subtropic regions. Lastly, rickettsiae are parasites that can cause diseases such as Rocky Mountain spotted fever and types of typhus. And these are also parasites that are transmitted through a tick bite, but not ticks that are found in our area on the East Coast. If it is happening in the United States, it's happening in the centrally south region of the United States, but normally it's in South America. So the chain of infection illustrates the sequence of events that allows infection to invade the body. So there's different types of way the infection gets in. It can be direct contact, indirect contact, and vectors. Hospital-acquired infections are specifically called nosocomial infections, and there's several methods that are used to break the chain of infection. So before moving on, I want to just talk about the modes of transmission briefly to make sure that you understand the difference. Direct contact is exactly what it sounds like. Direct body surface to body surface. And that can be from one animal to another, or from an animal to a human, or human to human. Indirect contact involves contact between the animal or person and a contaminated object, such as a toy. You've heard of foot, hand, mouth disease. Usually that happens because the bacteria or parasite is on a toy, and then the child puts that toy in their mouth. Indirect can also include droplets or airborne. So if you sneeze and you're infected and those droplets come my way, then that's considered an inanimate object. Or if the droplets dry on the desk and then I touch the droplets and then I put my hands in my mouth or whatever, rub my eyes, I can get an infection that way. And vectors are through another living organism, so infected fleas, ticks, mosquitoes, so on and so forth. Hospital-acquired infections are called nosocomial infections, and we're going to look at now several methods that are used to break the chain of infection. So before we look at that, I want you to think of ways that healthcare workers can prevent the spread of infectious disease. How can they break that chain of infection? So you should be shouting out some ideas of what you can do. There's one that's Captain Obvious here, people. So hopefully you said they can practice good hygiene, including frequent and proper hand washing. Also wearing gloves and then properly removing those gloves. And generally, if you're a hospital employee, healthcare worker, or student in a high school, don't come here or go to work if you're sick with a contagious disease, because then you're going to just make everybody else sick, and nobody wants your sickness. Hand hygiene is the single most important way to prevent the spread of infection. The Center for Disease Control has issued hand hygiene guidelines for all healthcare workers. How long should you wash your hands for it to be considered effective in the prevention of the spread of infection? Any takers? 5 seconds, 10 seconds, 20 seconds, 30 seconds, 1 minute. What's your guess? Well, it's a really weird number, and it is 20 seconds. It takes at least 20 seconds to wash your hands properly. And properly means with soap and water. That means scrubbing the inside, the outside, in between your fingers. If I were there, I would demonstrate for you. So cleaning the healthcare facility. A couple of things we have to look at here. Medical asepsis versus surgical asepsis. Basically, first of all, aseptic or asepsis means just being free from pathogenic microorganisms. There is a difference between surgical asepsis, which is a sterile technique used in surgery, and medical asepsis, which is referred to as a clean technique that involves procedures to reduce the number of pathogens. So surgical would make sure all pathogens and spores are removed, and medical is basically clean technique where you're reducing the number. So 3 levels of cleaning take place in a healthcare facility. We have sanitization, disinfection, and sterilization. To kill all microorganisms on a surface, the surface must be sterilized. So we know sterilization kills everything, but what's the difference between sanitization and disinfection? Sanitization just reduces, it does not kill all of the growth of the bacteria, viruses, and or fungi. Disinfection will kill all the surface microscopic organisms as claimed on that particular bottle that you're using. So there's all different types of chemicals, and some chemicals will only kill certain types of bacteria and viruses or fungi. So depending on what you're using, it's not going to kill everything. It will kill whatever it's prescribed to kill. To kill all, as I said, microorganisms, the surface must be sterilized. All right, myth or fact, using a warm air hand dryer after washing your hands is more hygienic than drying your hands with a paper towel. So this refers to what you're seeing in restrooms all over the place. There is no longer any paper towel dispensers, or very few, but there are various types of air dryers. Do you think that is more hygienic than using a paper towel? Share your ideas with each other, what you think it is. So this is a myth. Fact, using paper towels greatly decreases the amount of bacteria on the hands. Fact, warm air dryers can actually increase the amount of bacteria on your hands. I actually didn't even know that. So the real reason for people switching is not because it's safer, it's because it's more convenient. Students just wasting all the paper towels and leaving them a mess on the floor in the bathrooms, or rest stops on highways not having enough people working to go and make sure that the paper towel dispensers are filled. So it's more convenient to use air dryers, but it is not more hygienic. Preventing the spread of bloodborne pathogens. So we also have to be trained on this every year. Several body fluids or elements can transmit harmful pathogens. Blood is one. Semen and or vaginal secretions is another. Amniotic fluid, which the only way that you would be in contact with that is if you were around somebody whose water broke. And human actual tissue. So if somebody gets cut or they scrape themselves and somehow their tissue gets on you. For safety, healthcare workers should always proceed as if these substances are infectious, which means that whenever handling or dealing with any of these items, you should be wearing gloves and wearing protective personal equipment, lab coat and or aprons and or goggles, depending on the type of infection and where you are. In some cases, patients have to be isolated, meaning separate them from other patients so that they don't spread their infection. We have things in hospitals called isolation rooms. You can wear protective gloves, gowns, masks, face shields to protect against various types of infection. And healthcare facilities use two levels of isolation practices. There's standard precautions and then transmission-based precautions. So the general difference is standard is the minimum type of infection prevention practices that are used at all times for all patients in all situations. So that's basically just standard of care for minimizing the spread of infection. Transmission-based precautions are those that are used when the standard precautions are not sufficient in spreading a infectious disease. For example, airborne precautions, which protect against small airborne droplets or dust particles containing microorganisms. Droplet precautions protect against large droplet transmission, as in coughing or sneezing. And contact precautions protect against the spread of microorganisms through direct or indirect contact. So this is where you would be wanting to wear like one of those like jumpsuits, booties, hat, gloves, face shield, mask, the whole 9 yards. You've heard me mention PPE, personal protective equipment, throughout the presentation various times, and it includes all those things that I just said: face shields, safety glasses, goggles, gowns, gloves, and face masks. And that's to protect you against chemicals, various hazards, and infection. One of the most often but accidental in nature injuries come from needle sticks and other types of sharps, because they can spread infection. Because where have they been? In somebody else's body. Sharp objects and biohazard waste have to be disposed of properly. There are special containers for needles, and there are special containers for biohazard waste and or bags too, depending on the type of biohazard and where you work. The Needle Stick Safety and Prevention Act, and yes, there is an act, requires employers to identify, evaluate, and introduce safer medical devices to avoid needle sticks. There is specific protocol for the disposal of hazardous materials, and there has to be a hazardous materials and waste management plan for said procedures that has to be in writing within the facility guidelines. All facilities are responsible for training personnel who come in contact with hazardous materials and waste. And proper emergency procedures need to be put in place, and every employee has to be made aware of those emergency procedures in the event that they have to be utilized. Most of the waste from healthcare facilities is non-hazardous. Leftover food, cups, medicine bottles. So recycling procedures are and should be used when disposing of non-hazardous materials. So can we recycle it? Can we reuse it? And then we also have to put into place those things that cannot be recycled and how should they be handled. Efforts should be made to purchase products made from recycled materials. Although this is suggested, this can be also very costly. Every organization does what they feel is best. I know some places in fast food industries have switched to paper straws. That's one example of buying stuff that's made from recycled materials. Some people have gone to using cardboard food trays. I think we still use styrofoam here. Eco Club should be on that. What are some examples of materials from hospital waste that could be recycled? What are some things that hospitals use that could be recycled? This might be hard for you to come up with if you've never been in a hospital or spent any time in a hospital. But paper waste is recyclable and includes cardboard, high-grade office paper, newspaper, any type of mixed paper. Other recyclable materials include plastics and disposable liners, because that's a type of plastic that could be recycled. And food waste. Food waste can be recycled and made into compost. If everybody did their part, whatever little part that was, you've heard the expression, a little goes a long way. The problem is someone says, I don't want to recycle because nobody else is recycling. That's a really poor attitude to take. Okay, you need to set the example, and then others will follow. So that's all of the notes on Chapter 4. You have access to just the dry PowerPoint, and then you'll also have access to the video again should you need to listen to it. At this time, you're going to start working on some of the worksheets. And please don't forget, you have a quiz on Chapter 3 vocabulary on Thursday. Please make sure you study it, and I will go over the tests that you just took on Thursday as well.